Welcome to my show. I'm a guest here. Her name is Athena Hall. Mrs. Athena, how are you doing, ma?
Yeah, I'm doing really well. Thank you. I'm excited to be here.
Thank you so much. I'm also excited to have you on my show. Thank you, Mrs. Athena. Firstly, you are a speaker. You are also the founder of ZNA, and you're also a healthcare transformation leader. Can you please, ma'am, discuss more about yourself and how you're doing currently now, ma'am?
Yes, so I founded Xena Health Network at CNA uh, because I wanted to include our communities in the development of our healthcare system. And I wanted our healthcare system to be more accessible and to address the health inequities that we see. So I did some global health work right out of residency training. I lived in Rwanda for a year and on a Navajo reservation. And during that time, I saw a lot of the challenges in our healthcare system with the hierarchical structure and the lack of inclusion of the communities in our decision making. And I saw the impact of that on the community. And when I came back to the US to work, I saw that it's happening here as well. So I wanted to create a platform where we can move through all the fragmentation and silos within our healthcare system and come together to shift things in a different direction.
All right, thank you, Mrs. Athena. And as a healthcare transformation leader and a speaker, have you written any book or are you planning on writing any book in the coming future, ma'am?
I don't have any plans for a book in the near future. This year, I'm wanting to do more public speaking
Hmm.
to get my message out and to shift people's perspectives on what's possible in healthcare. There's so many incredible models that are already happening throughout the world and through the US of community centered healthcare that has really incredible outcomes uh, with reduced mortality and reduced chronic diseases. And all we have to do is learn from those models and implement them in our local communities. So I don't have any plans for a book, but I will be doing a lot more public speaking.
All right, Mrs. Athena, thank you so much, ma. And in today's world, there are a lot of big challenges. We are in the modern world. A lot of things have changed in the healthcare system. Can you please, ma, tell us, what you personally see as the biggest challenges facing the healthcare systems today, ma?
Yeah, there are quite a few challenges, but I feel the biggest ones are that our healthcare system is really a disease model. It's focused on fixing symptoms and offering medications for uh, symptoms that people come in with late stage in their disease process rather than a focus on prevention and keeping people healthy. So our model is very reactive and illness focused. And I feel that we really need to start addressing the root causes of disease and keep people healthy. And some of those root causes are the social determinants of health, like where people are living, what is their environment like, are they struggling financially? All of those things contribute to illness along with their mental health. And if we address those root causes, then we won't see people in hospitals so much and see them so sick. And another really big challenge is the fragmentation in our system. We don't have a lot of communication between providers. Everything's very siloed, which makes it difficult to navigate our healthcare system. And it's not really putting the patient at the center. There are some healthcare models. There's one in Alaska where the community is they're part owners of the healthcare system, and their healthcare teams work together and communicate really well to make sure that each patient is all of their needs are being addressed and they're being listened to. So I feel fragmentation is a really big challenge. And lastly, our inequities in care are a huge challenge in our healthcare system. Um, Black women in the US have an almost 3 times higher risk of dying during labor and delivery, and they're much more likely to have chronic diseases due to chronic stress and difficulties in accessing care. So there's a lot of inequities that can affect many people, and overall it affects all of us. If we're not treating everyone and caring for everyone in our communities, then everyone is impacted.
Yeah, completely agree, Mrs. Athena. Thank you so much, ma. And there are rural areas and also probably undeveloped areas, in every, you know, countries today. And sometimes, I don't want to use my country, but sometimes, this healthcare are not always, these solutions are not always getting to those rural areas. I would like to ask now, how do you think, rural or probably underserved communities, how do you think they can benefit from these innovative healthcare solutions, ma?
Yeah, so I feel I learned a lot when I did my global health work. I actually came in thinking that I was going to be teaching a lot of people, but I ended up learning so much more.
Hmm.
And one of the things I really learned was the value of community health workers. I feel that just simply having people that are from the community who are trusted and understand the community, they understand the culture, and if we use community health workers to bridge um, the gaps in care and have them come out into the community, um, checking in on people, making sure that they're able to access the care that they need and that their needs are being addressed. I think that is an incredible, innovative solution, although it sounds very simple. It's not, technology heavy, but I do think that we need to go back to, thinking more simply about healthcare in a lot of ways.
Mm.
And so I think community health workers would be a really um, huge make a really huge impact on our community's health. In addition, there's telehealth services. After the pandemic, we realized the importance of telehealth that can reach some underserved areas. And then mobile health clinics have also been hugely beneficial, even through the US and some rural areas. Um, yeah, and then we also, I feel, really need to include the community in our decision making and listen to what services that they need. So in some of these rural areas, we're just doing kind of a one size fits all in all of the areas, providing the same care. But if we're listening to the rural communities and what they need specifically, we can adjust which services that we provide.
Hmm. Thank you so much, Mrs. Athena. And in the modern world today, there are high rates of, penetration when it comes to website hacking, stealing of data, a lot of things happens today in the digital world. And I would like to ask Ma, what safeguards do you think are also needed to protect patient data as healthcare becomes more digitalized, Ma?
Yeah, so I actually don't know a lot about safeguards for protecting patient data. I
Hmm.
know, of course, we need to have a lot of encryption and make sure that there's, you know, privacy with data access. Um, but I think a big part is just making sure that we have a lot of transparency and patients feel like they can trust that their data is being used in an ethical way and only for their healthcare needs. So, yeah, but I don't know a whole lot about data protection.
All right, Ma. Thank you so much, Mrs. Athena. And I would like to drive more on qualities as an a healthcare transformation leader. Ma. What qualities do you believe are also essential for leaders driving into the healthcare transformation? Ma?
Yeah, so leaders that are wanting to transform the healthcare system, I feel, need to be able to hold a vision. And so that may be a vision that they have developed from their experience or something that has come together from the people that they're collaborating with. But to be able to hold that vision up and for everyone to be moving towards that, I think it's really essential that leaders have humility, that they're able to uh, accept feedback and be open to changing um, their perspectives and their behaviors uh, so that they can work well with other people and learn and evolve over time. Um, it's really important that they are uplifting other people in their team. Everyone comes from different perspectives and backgrounds and has so much to offer. They have different skills and abilities, and so if a leader is able to lift them up and foster all of those qualities, then they could have an incredibly strong team. So, um, yeah, I think. And then lastly, being very adaptable is important. If you're wanting to be a leader in transformation, you need to be able to adapt to all the challenges that spring up and everything that is changing over time. You need to be able to shift your focus and weather all the different storms that come up.
Thank you so much, Mrs. Athena. And lastly, if you do have any advice for aspiring leaders in the healthcare transformation, ma.
Yeah, so my advice would be to stay curious
Hmm.
and be open to learning from different perspectives. So I think that curiosity is something that perhaps in the medical field and in science in general, we've lost a little bit. There's a lot of people who are attached to what they know and what they've learned in their schooling and in their training. But if you speak to somebody in the community, they may have a completely different idea of what healthcare should look like. And so just keeping your mind open and learning from the people around you is so important. And then building relationships with people in your team and with the community you serve is another thing that I feel would be really great for aspiring leaders. If you prioritize um, the voices of the people around you um, and you really try to build relationship and trust between yourself and your team and your community. So, and then transformation can take time. So you have to really just, keep putting one foot in front of the other, take one step at a time, and stay focused on where you're going. So
Mm.
that would be it.
Yes, I
Yeah.
completely agree. Thank you so much, Mrs. Athena. And I normally do ask a question, Mrs. Athena. From the forefathers, from the ancestors, there are a lot of things that are, do exist during our ancestral time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, what do you think that thing would be, ma?
That's such a great question. I think I would love to just bring back a lot of the indigenous practices and wisdom. Our ancestors from different areas, they have so much wisdom that they, you know, collected over time through storytelling and just being in relationship with each other. In our modern society, we have a lot of isolation and people, like stuck in their phones and not really listening to each other. And so I think learning from our ancestors and how they really respected their land, they respected each other in a lot of ways, and collected wisdom over time through their experiences and through the experiences of everyone around them. So,
I completely agree, Mrs. Athena. The modern world today, the technology, technology is great, enlighten one, make life probably more easier for some certain people, but it has also, taken a lot of experiences away. I personally used to try to probably watch, some movies, also learn from my dad when it comes to, my past experience. It was, very beautiful experiences. There was community, there was connection, there was physical, communication and stuff like that. But probably, some people still feel like that time is still this time, some people still, but technology has taken over, most of the things have been done in the internet. I want to sincerely thank you, Mrs. Athena, for this time and this opportunity to speak to me and also speak to the audience. Thank you so much, Mrs. Athena.
thank you so much. This has been really wonderful.
All right, have a wonderful day, Mrs. Athena. Bye bye.
Okay, bye bye. Thank you.